Hello, everyone. This is Dr. Lindsay Weitzel. Welcome to Heads Up, the weekly podcast of the National Headache Foundation. I am Lindsay. I am a migraine strategist. I am founder of the Facebook group Migraine Nation, and I'm a chronic daily migraine survivor. And I am lucky enough to be here today with Jill Dehlin. Hi, Jill.
Hi.
Jill is a registered nurse. She is also a certified health education specialist. Our topic today is the emergency room and migraine. Jill has given talks on this topic, and she also has migraine. And so I thought she would have an awesome perspective to talk to us about this, and it's such an important topic. So let's start by having Jill tell us about her background and how she got into spending so much of her time working with migraine.
Thanks a lot, Lindsay. I have been a nurse for a really long time, and I went back to school to become a health educator, and because patient education is always the thing that I really love the most.
Mm-hmm.
So while I was working on my Ph.D., I started having a migraine every day. And it wasn't until about 4 years in that I got the courage to stand toe to toe with my healthcare provider and tell him that what he was doing really wasn't working for me.
Mm-hmm.
So that kind of lit the fire for me to be an advocate. And it started out with just being an advocate for myself. So since that time, I am on the boards of lots of different organizations, including the National Headache Foundation. So I'm really proud of the work that's being done right now in advocacy for people with migraine, and it's a really important part of who I am. So thanks a lot for asking me to be here today.
Thanks for being on today. And I'd like to point out that Jill has an amazing, maybe one of the best I've seen, purple streaks in her hair in honor of the migraine color. I love it. So let's go to our first question. First of all, we would like to avoid the ER if we can.
Yes.
As people with migraine. So should we work with our physicians to come up with an outpatient plan, meaning for our worst migraine, a plan to keep us out of the ER first? And let's discuss how we do that.
Right. They're just like people with diabetes, people with migraine have to manage their diseases on the fly at home.
Mm-hmm.
And it's really important for people with migraine to know how to take care of themselves before the pain or attack gets so bad that they feel like they need to go to an emergency department.
Right.
So this kind of home plan or outpatient plan is going to be different for every physician and every patient. But your physician should really spell out in writing what you should try at home before heading to the hospital.
Right. And I know that on a previous podcast, I think Dr. Martin has even called it sort of like an emergency kit. Talk to your doctor what to put together for your emergency type migraines. So this is probably the most important question of this particular podcast. How do we know when it's time for us to finally have to go to the ER?
Well, most people with migraine know their typical symptoms. It's when something is not typical that you should head to the emergency department. Something like a fever, weakness, visual changes, confusion, dehydration from nausea and vomiting, not being able to speak if that's something that's new for you. Stiff neck with a fever is something that people don't think about, or really sudden onset like a thunderclap of pain and the worst head pain of your life. Those are indicative of something that's really quite serious.
Mm-hmm. Okay. Should we call our doctor before heading to the hospital? Is that part of the protocol usually, or do we just go?
It really depends on what kind of arrangements you've made with your physician. Sometimes if a physician is called and you're thinking about going to the hospital because you're in the middle of a horrible attack, maybe he or she can come up with some kind of a plan for you to follow at home, something that maybe you haven't thought of before. Or perhaps they can fit you in for a quick procedure like occipital block or something like that, just to keep you out of the ER. But again, these are things that you need to talk about beforehand.
Okay. And then once we get to the ER, what should we ask for?
Um, Well, first of all, your goal should really be to try and avoid the emergency room. But
Right.
if your migraine disease isn't under good control, then absolutely you should have a written urgent care ER migraine plan. So, what you should ask for is from your physician before it gets to that point.
Right.
So, it's like planning.
Right.
You ask your headache doctor what to do if you're experiencing a really bad migraine attack after office hours.
Right.
What kind of symptoms would make it necessary for you yourself to go?
Mhm.
Not all physicians have privileges in all hospitals. So, is there a hospital that that physician prefers that you go to?
That is a really important point that I think most people aren't aware of. Yes.
Right. And then have a written set of instructions for the ER staff from the physician on
Mhm.
what he or she recommends for your particular care, because it's
Yes.
different for everybody.
What
And
should you
then,
bring with you to the
oh
ER?
gosh, I
Yeah.
have a long list.
Okay.
Um, and I know that Dr. Vince Martin talked about this before, as having a little kit.
Mhm.
Sometimes when people are pregnant, they have a little go bag
Right.
ready to go in case they have an emergency
Yes.
delivery, like in the middle of the night.
Yes.
So I think if you are anticipating having to go to the hospital for any reason, especially if it's for an emergency room visit for migraine, you're not really thinking very clearly. So it's
Mhm.
really important that you think ahead of time and maybe pack a little go bag. And in that go bag, you should have the following things. And I wrote them down because it's a long, long list. You should have a written list of what your symptoms are,
Mhm.
including any that are new to you. You should have that letter or note from your doctor verifying your medical problems and what should be done about it. Have a written account of your medical history. This is something I started doing for my mom. And then when I started being on more and more medicines and having more and more issues, I started doing it for myself. So the last time I had to go to the ER, I had a sheet of paper with me that had all my allergies, all
Mhm.
the medicines that I was taking over the counter, which means like herbals and vitamins and stuff like that, and all the prescription medicines, and all of the medicines that I take
Right.
as needed, and all of the medicines that I take on a daily basis for preventives. Um, I would also recommend that you have a list of medicines that you've taken in the last 48 hours, so the
Right.
hospital staff knows what you've already tried. And you should also let them know what meds have worked well for you in the past and what hasn't. You should make note of any allergies or adverse reactions to your medicine.
Mhm.
And then you should have a list of all of the past and current medical problems, illnesses, injuries, surgeries. Have the name and contact number for your healthcare provider so they know
Right.
how to get a hold of that person.
Right.
Other things that you should bring, of course, are your insurance card, your ID, like a driver's license or something like that. If you have a copy of advance directives, like a living will, bring that because they'll ask you for it. Uh,
Mhm.
they don't think you're going to die, maybe, but they'll ask you for it. Bring an advocate who can help you out. I know when I have a really bad migraine attack, I can't really speak very well.
No.
And I can't think very well, and I can't advocate for myself very well. So
Yeah.
it's really important that you bring somebody with you.
That is so true. Even if you are in the medical field, you know the name of every medicine on earth. They'll be like, which ones have you had reactions to? And I will literally sit there. I can't think of a single, you just can't. So
Oh,
it's important to have a list of these things.
write it down. And then be prepared for a long wait. You're lower on the priority list,
Mhm.
most likely. So bring the medicines that you usually take. You might have to, if you're there for more than 4 or 5 hours, you might have to take your blood pressure medicine or your preventive or something like that. Bring something to drink, a beverage in a closed container, some snacks maybe, some sunglasses because of the bright lights to help protect you from the light sensitivity, and maybe some earplugs.
Bugs.
Right. A good friend of mine, always, wherever she goes, she has a neck scarf around her neck. And then if somebody has perfume on or something like that, she just puts that scarf over her face, and that really helps to block off the noxious odors. If heat helps you, bring a heat pack. If ice helps you, bring an ice pack. Mints or those little gin-gins for nausea. If you use essential oils, I do. I put them underneath my nose to, help with nausea and helps with the bad smells. And then sometimes when I have a migraine attack, I feel really chilly. So if you have a little airplane-sized blankie at home that you can bring with you, bring that too. And if this sounds like you're getting ready to camp out, it's better to be safe than sorry. Yeah, you are.
Yes. You are usually getting ready to camp out. Not always.
No.
Yes. Okay. So here's a really good question. And it's an important question because different emergency room staff have different experiences with migraine patients. So if you are offered opiates at the ER for your migraine attack, are there reasons that you may want to take them or not take them?
The use of opiates is really controversial in headache medicine. They should really be used as a last resort when nothing else has worked. And the reasons for this are many. I've got another little list here. It might cause disease progression, like you might get worse and worsen your condition. Once it wears off, those opioids wear off, then you are more sensitive to pain, and it actually lowers your threshold for responding to triptans. It can temporarily cover or mask the pain for short periods of time, but then maybe once the opioid wears off, your pain is worse than before. And I don't know about you, but if I've ever taken an opioid, they make me nauseated. So if I have nausea from my migraine and then I have nausea from an opiate, that's not a good combination for me. So those are some of the good reasons.
Okay.
But really, like, migraine is a whole syndrome, and giving somebody opioids is really just hitting at one part of that syndrome.
Right. And then let's touch briefly on migraine stigma in the ER and why does it exist and what can we do to address it?
The most important thing about stigma in ERs is that people really don't understand. They're not well educated about migraine. They don't know how to treat migraine. They can't see it in a test, so they're skeptical. And probably the biggest problem is that healthcare professionals do not get very good training at all on how to treat headache disorders. So when you have an invisible illness, you have people claiming this invisible illness just to seek drugs, and then you have hospital staff that are not well educated about what migraine is, then it becomes really problematic for the people who are seriously suffering from this disease.
Exactly. That was an important question and a really good answer because I think people are always going to experience a bit of stigma. There's going to be great experiences when you go into the ER. There's going to be not so great experiences. But I think if you know where the stigma comes from, it might not hurt so bad when you experience it when you go in. So I hope everyone heard that. Is there anything else you'd like to add to our topic of migraine in the emergency room?
Yes. So we talked about if people are treating you poorly in the emergency room because of your disease, you shouldn't have to tolerate that.
Right.
And if someone is rude to you or unprofessional to you,
Mhm.
you should write their name down, and write a letter to the hospital,
Mhm.
or you can ask the hospital has a patient advocate that can come down and help
Right.
you out. If you're not being treated fairly, uh,
Mhm.
you could ask for the nursing supervisor to come and intervene on your behalf, because nobody who has a legitimate reason to be in an emergency room should be treated cruelly or unfairly.
Okay.
Yeah. The other thing I wanted to mention was that once you're discharged from the emergency room, you should ask for a copy of your discharge summary, the notes, um, anything that can help your own physician manage your care, because the next thing that you're going to have to do is make sure that you contact your healthcare provider and let he or she know that you did have to go to the emergency department, and
Mhm.
this is what happened, this is what they did. And once you get back in to see your healthcare provider, you can hopefully find something that will help you avoid going to the emergency room in the
Right.
future.
Right. Thank you so much. That was awesome information. I hope everyone found something that they can use, and I do hope that everyone manages to not have to go to the emergency room, because it really is the best option. So here is Jill Dehlin and Lindsay Weitzel signing off of this week's version of Heads Up. We will see you next week.